Okay, welcome back, folks, to our last panel. Um, I have known and worked with all of these folks for many years, so very happy to have them on board. The whole point behind this panel was to look at strategies that government and industry can take to work together. Both Kelly, Chris, and Tom, I believe, Tom, you've been in government and industry as well, right? I believe so. I know Kelly and Chris have. Um, and I know Tom Farmer works across multiple groups, if you will, that address these private public issues, especially at the federal level. So I'm going to introduce Kelly as our facilitator. Um, and then I know Chris will be joining us here in just a minute. Yeah, he'll be on here. So our facilitator is Kelly McKinney. Kelly facilitated this a little bit earlier, but for those you don't know that are chiming in here, uh, Kelly's had a leadership role in pretty much every major disaster in New York City since over the past 15 years, all the way from the aftermath of 9/11 attacks to present day. Kelly served as deputy commissioner for the Office of Emergency Management in New York City and is also as chief disaster officer for American Red Cross in the Northeast. Kelly's published a book called The Moment of Truth, The Nature of Disasters and How to Prepare for Them. Tremendous book. I read it twice. Great principle for planning and research. Just so many things that come out of that. He's a professional engineer with a bachelor's degree in mechanical engineering from University of Kansas and a master's degree in public administration from Columbia University, New York City. He currently serves as a senior director of emergency management for enterprise resilience at NYU Langone Health and serves on the board of directors of the All Hazards Consortium. So, Kelly, we'll turn it over to you, and we'll find Chris.
Thank you, sir. And thank you, Tom, for inviting me here as your moderator. And thank you, Laura, for everything you've done to put this virtual summit together. It's been a great day so far. I was a moderator of an earlier panel on the earlier panel. It was cross-sector resiliency with Sherry Stone from Energy Marketers, Doug Baker from the Food Industry Association, and Robert Crow from AmerisourceBergen pharmaceutical manufacturers. And so it was talking about the cross-sector dependencies and interdependencies across those critical infrastructure sectors. This conversation tonight is, it sounds the same, but it's actually much different. And that's because when you talk about silos, there are silos and then there are silos. The silos between different industry sectors are real. Those are hardened silo walls. And what the All Hazards Consortium does is bring those silos together before the disaster to enable better outcomes in the disaster. The silo walls between government and industry, if anything, are triply more difficult to overcome. There's a lot of distrust there. There's a lot of misunderstanding between those two critical sectors. And that's what we want to talk about now. We've got Tom Farmer with us. Tom, I'm going to ask you just to introduce yourself, talk a little bit about what you do and how you got here.
Well, thanks, Kelly, very much. And I appreciate the opportunity to be a part of this panel. I serve as the Assistant Vice President for Security with the Association of American Railroads. Our association represents the major railroads that operate in the United States, Canada, and Mexico. So our principal members are the 7 Class 1 railroads, BNSF Railway, CSX Transportation, Canadian National, Canadian Pacific, Kansas City Southern, Norfolk Southern, and Union Pacific, as well as Amtrak. We also have a sizable range of short line railroads. That includes Genesee and Wyoming, which owns dozens of short line railroads in the US, in Canada, in Europe, and Australia, as well as a growing number of commuter railroads, largely with outreach we've had through security information sharing, and that's brought them into the association for the broader work that we do. In my area, we focus principally on the security plan that we've implemented as industry that dates back to the weeks after the 9/11 attacks. We also lead the industry's efforts on critical infrastructure protection, on emergency preparedness. It is very much a unified approach based on a plan that's been in effect for almost 20 years that we have over time improved in its execution through enhanced capabilities, through better coordination procedures, and particularly through interaction with government on security and emergency preparedness priorities. I'm invited this afternoon, I think in large part because of the great work that Tom Moran and I do together through the All Hazards Consortium and the Critical Infrastructure Cross-Sector Council. And I was privileged to chair that council for a 5.5-year period up until 2018. So with that background, Kelly, I'll turn it back over to you with an apology that I was not able to get with you when you wanted to do the preparation in advance. We unfortunately had a lot of activity.
Oh, that's fine. Tom, you at least reached out. I mean, that's more than I can say for our other panelists. The distinguished Christopher Geldart. And Chris, are you on?
Yes, sir, I am.
Awesome. So, Chris, could you, I think there's a lot of people on this call. I think we've got 120 plus on this call. Probably 118 or so know you already and know you well and call you friend. But can you just do what Tom did and talk about yourself and how you got here and your life story in 2 minutes or less, please?
Not a problem. It's not that interesting anyway. Chris Geldart, I'm currently the director of public works for Washington, D.C. I've been the public works director, the emergency management and Homeland Security director, and the 911 director for Washington, D.C. at all different given times. Prior to that, I did some work at the federal government as an SES and FEMA. I was the deputy director up in Maryland for Homeland Security, and a Marine for several years before all of that. Been both inside government and out. So I've worked both sides of the fence. Happened to be lucky enough to be around on the ground floor for the All Hazards Consortium when Tom Moran and I sat in a building just outside the capital of Maryland, and with a esteemed colleague, Dennis Schrader, and took a vision of his and brought it together as the All Hazard Consortium. So been lucky enough to be around for that and fall under the tutelage of Kelly and others over the years in this thing we call emergency management, as well as what Kelly was talking about earlier, is that relationship need that we have within that field and others to really get, as Kelly would say, big jobs done. And the consortium has gone along a path of making sure that we have good people coming together to solve hard problems, and then have that relationship, that trusted relationship to work big jobs. So lucky all around on that. Kelly, thank you for the 2 minutes to do that ramp up, and look forward to the panel.
Awesome. And Chris, he said it, but just to repeat, Chris used to run emergency management for the district for many years, and then he tried to leave. They brought him back, and now he's running public works for the district. And then they figured he had a lot of free time, so they made him the boss for all coronavirus activities for the district. That's a tremendous wealth of knowledge and insight, Chris. And I think we want to try to draw some of that out. Just those pain points, from 2020, especially early on. I think that's the most interesting stories that we're hearing is, what did you do early, and how did you do it, and how did you get your information? And I want to talk to Tom about that and Chris about that now. That's what I think. That's where I want to go with this, is just to say, put yourself back into January 2020, when lots and lots of people were trying to talk the job away, and they were looking at this novel coronavirus. Most of them never even heard of a coronavirus, and that was sort of devastating. This central China, this what to many people is an alien place, and they said to themselves, look, I see it happening over there. I just, I just don't think it's going to happen. That's a different place. It's not coming here. I'm going to hope for the best. And there was a lot of delay in many cases, not only on the part of the public, but even in the critical infrastructure sectors, and even in the emergency management sectors, frankly, and in government and in industry. It's funny now when you look around in social media. We're actually here at NYU, January 26th. We activated 1 year ago today. This is our 1 year anniversary. But when you look around, a lot of people are talking about, oh, we were already working. We knew it was coming. We already did our sit reps, and it's like, I'll tell you, when we activated on January 26th, it seemed like we were the only people doing it. Like, we couldn't find anybody else that is even worried about it at that point. So, but let's do that for now. Let's go back to January, and maybe we start with Tom, and talk about talk about the early days of the job, and what were you looking at? How were you getting your information? Did you activate your teams? And what did you learn early on?
So there's two elements to this, Kelly, and appreciate you raising the question. One is the work that was accomplished very early on, going back to January 2020, by the Chief Medical Officers Committee that we maintain in the industry. And AAR, my organization, serves a function of providing a means of coordination for what are competing organizations. And so, with certainly clear respect for antitrust laws, we provide the forums in which railroads can collaborate on areas of common interest. The major railroads in the US and Canada have chief medical officers. Generally, their principal responsibility is to assure the health and safety of the employee workforce. There's a range of activities they engage in for that purpose, but they're also the focal point for pandemic planning. And in the heavy rush of activity following 9/11, when there were needs to assess risks in a wide range of areas, that process of preparing for pandemic illness, biologically based hazards, was part of the overall industry preparedness efforts. And then the H1N1 flu epidemic, going back a little over a decade, was the first effort to actually put some of those plans into effect. We've been blessed with a long stretch of time since then without having to address the problem, but the framework was in place with this existing structure of railroads through their chief medical officers and the coordinating committee we had. So when the CDC began to hold outreach teleconferences, and I think they started in late January with private sector organizations, the railroads participated thoroughly and began at an early stage in February to put into effect what were the recommended approaches then in terms of workplace hygiene, advice to workers on health practices to mitigate the potential for spread of the virus. And then it's interesting, like any organization, you have to see, well, what role can we constructively play in a program focused on security and emergency preparedness for those kinds of efforts? And the niche that we found was the work with government in trying to anticipate what's likely to happen next. So if the virus begins to spread in the United States, what actions might be taken by state and local authorities to curtail that spread? And so early on, by the early part of March, latter part of February, we were thinking in terms of what happens if states or local areas, local governments put into effect some sorts of restrictions on the activities of their residents. What would that do for our operations if we have trains going through those areas covered by those restrictions? So we had the structure and the outreach and the engagement with CDC through the medical community in our industry, and the role that our committee stepped into play was try to anticipate where those operational hurdles might come up. So if we're protecting our workforce well, are we going to be tripped up because some of these state-based or county-based restrictions will prevent our employees from working? And that effort began the process whereby we were reaching out to DHS through its Cybersecurity Infrastructure Security Agency on this concept of an exemption for workers who need to continue to perform their jobs for the economy to continue to function. And eventually that led to DHS issuing the Essential Critical Infrastructure Worker Guidance that created this exemption recommended to states and local governments for workers that perform critical functions across industries. So at that early stage, again, we had the framework of the chief medical officers group engaging with CDC and putting into place the sorts of foundational practices that did do well in limiting the transmission of the virus on our industry. We had a far lower percentage of railroad workers with COVID-19 than prevailed in many areas through the society as a whole. And then secondly, the role that we played, and let's try to anticipate the problems. So the stay-at-home orders, the travel quarantines, and ready ourselves to be able to try to secure an exemption for workers so they could continue to function and avoid a more severe economic downturn than we had to endure.
So, it's going to sound like I'm trying to sell my book, but the title of my book is called Moment of Truth. And Moment of Truth for me, I've been in New York a long time and working in a lot of disasters. And the moment of truth for me is when I see the job in its entirety for the first time. A lot of times you're working a job and you know there's something happening, but then there's a moment. Maybe it's 20 minutes in, maybe it's an hour in, where you finally see the enormity of it and you realize, sort of that mountain of work that you have to sort of get over it. Did you have one of those, Tom? Did you have a moment where you said, okay, this thing is this is big. This is going to be this is it. This is and what was it? What made you understand the enormity of the pandemic and its impact on your sector?
Well, I think for us, it was beginning to see the surging of cases in the latter part of February and anticipating that there was going to be some action taken by states that were really dealing with surges to try to curtail the spread, and that those actions were going to entail some form of restrictions on the ability of people to get out of doors, to continue to work. And so for us, again, it was the early part of March when we began to raise with DHS. There's a strong likelihood here that state and local authorities will see some form of quarantine, some form of lockdown as the solution to curtailing the virus. We didn't base that on any medical insight. It was just a recognition that as the number of cases began to look like they were getting out of control, states were going to try to take drastic actions that were unprecedented in our experience in our lifetimes professionally to try to curtail the spread. So for us, that was it. We looked at it and said, the numbers are getting high. They're surging in some key states that we operate extensively in. New York happened to be one of them. We need to anticipate what could happen in terms of potential impediments to our ability to operate.
Yeah.
And another was recognition that we're going to need to ensure our workers are protected and make sure they've got the right equipment for that purpose. And that got into eventually led into the issue of the facial coverings. And it was interesting. There we found a really significant challenge was probably early April. FEMA began to procure facial coverings in high volume with a view toward aiding certain sectors and ensuring they had adequate supplies for their workers. We began to find railroads going to their usual suppliers being told, no, we don't have any facial coverings to give you because they've all been, quote, seized by FEMA. Well, we kept going back to FEMA, and FEMA assured us they weren't seizing anything, but they were buying them in such quantity and generally at a higher cost, a higher price than what normal customers would pay for facial coverings, that the opportunity for railroads to obtain them from the usual suppliers simply wasn't there. So that led to another initiative working with FEMA. Hey, if you're procuring what ran into hundreds of millions of these reusable facial coverings and you're giving them to some sectors, what risk-based approach are you using to determine which sectors, which categories of workers to be receiving this equipment? So that led to, we succeeded in getting a distribution of more than 15 million reusable cloth facial coverings for the transportation sector broadly, aviation, mass transit, freight railroads, pipelines, trucking companies, maritime organizations. But the trigger point for us is we saw the surges in cases and we realized there's going to be some action taken beyond simply telling people to wash their hands. It's going to involve restricting their activities. And when that happens, it's going to impact our operations because we operate through those communities.
Yeah, I mean, you got to move. You move
Yep.
stuff, and so anything, when you're doing it across the entirety of this massive nation, if everybody is restricting movement, that's a classic moment of truth moment, right? Where it's just like you're looking and you're like, well, how many conversations do I have to tell those people that they got to let my railroads through, right? I
Right.
mean, like
Right.
it's a lot.
Well, and I think
Um,
just one more point on that.
Yeah.
It's recognizing that if we can't move, then commodities needed
Yeah,
for societies to function aren't there. The
yeah,
food doesn't get to the shelves. The the chlorine doesn't get delivered to make sure the water is clean. The products that people need to buy on a regular basis aren't available. So as difficult as a problem we had with supply chains, particularly early on in the pandemic, it would have been far worse if you had
right.
railroads unable to operate through large swaths of the country because of local restrictions.
Yeah, absolutely. It's like blood through the veins of the body politic, right? I mean, there's the, all of a sudden it's going to start to die, right? Chris, so Chris, you're such an interesting case for so many reasons. But so talk about January, February, Chris. I mean, you were at Public Works, but you brought an emergency management mindset to that job. You were probably looking at what was going on, and you were thinking, well, we got to be doing this, we got to be doing that, in the context of your own department and even the whole district, right? So talk about that a little bit. And did you have a moment of truth where you realized the enormity of what COVID meant for DC and for the country?
Sure, thanks. And Tom, that was a great rundown, by the way, from the perspective of where you guys were in all of this. Kind of similar for us, of course. Our health department. This starts to happen, and as you know, Kelly, in the emergency management field, the first thing you're saying is, "Oh, we got a plan for that." And but unfortunately, as in many cases, and I'm sure most folks on this call know and have heard and seen, not everybody, one, remembers you have a plan, or two, thinks that the plan may be pertinent and still relevant. So part of that time frame was reminding folks that we've actually thought about this. And then not only for the pandemic plan that we, in just about every other jurisdiction in the country, has to one degree or another, we also have a big response plan for how we deal with big jobs or big disasters. So it was really, as the apparatus was reeling with what's going on coming from China and coming from other places, and then starting to see what was happening in New York and other major metropolitan areas, and reacting to that early to get in pharmaceutical interventions and talking about shutting things down and doing all those things that Tom was, preparing for as well. As those conversations are happening, is reminding everybody that as you're doing that, you've thought about this and we planned for it, and we have this apparatus that we need to stand up on a scale we've never stood it up to before. And for probably what will be a much longer time and than we've ever done before. And so that was really, in the early days, my focus with the mayor and our senior team was to say, yes, this is big. Yes, this is unprecedented, but we have plans and we have processes and procedures to follow, and let's follow those and not create new ones, so that we're not figuring this out or building the aircraft carrier as you're floating in the water. So really pushing into maintaining our procedures and our ways of doing things was a hard thing early on, and keeping people in the box and in their boxes, and everybody doing their jobs. Big Bill Belichick or fan. Everybody does their job, we win Super Bowls, right? So if everybody does their job right, the way we're supposed to in these things as we plan for, we're gonna come out ahead. And that was a big push early on. Information coming in through the health departments, CNN was a major feeder, I think, for everybody in this, as we're watching New York and what's happening there. The supply chain issues and things that were going on, but really breaking it down to, okay, what are the first things that we need to really consider? Looking at those non-pharmaceutical interventions, how do we break the curve? What do we need to do with our residents? What needs to shut down? How do we shut down? How do we maintain? And then what do we need to be doing and providing as government And then how do we work with, the whole healthcare sector to make sure that we're doing things we can do in government, and some things we've never done in government before, to make sure that that posture can be maintained. So medical surge early on, of course, that's where everybody went to, PPE, purchasing and all of that. And we struggled like everybody else in the nation did, on that, getting ventilators and then everything else you needed in PPE side. I think, but the biggest thing for me from an observation in this was maintaining the fact that we actually have relationships, we have mechanisms in place that we do on small jobs, medium-sized jobs that are the same for the big jobs. They're just bigger in size and scope. And then reminding our senior team, the mayor and our city administrator and all of that, that this is a marathon at this point. We're going to be doing this for a long time. So we need to follow the procedures and we need to pace ourselves through this. And we don't need everybody in one place in an EOC like we would in the past. We need to be spread. We need to spread ourselves out. We need to go virtual with the things that we can go virtual with. And all of that was in the early days. And then I'm sure you're going to go to this, Kelly, but then the transition periods, right? Going from medical surge and making sure you have everything you need there to address the amount of folks that you're going to have to take care of in your healthcare system, as you know very, very well. And then a transition from that as you do break the curve and into testing and tracing, and then the transition in testing and tracing to vaccination. These have just been major operational things that could, break you. Each one of them could break a process in a system and be very difficult. Just one after the other, that's just been sustaining over the year. And so that ability to keep everybody focused and keep everybody inside the process and inside how we do things, and kind of wash, rinse, repeat on each of these big areas of how we do things with operations and planning and logistics, and then operations and planning, just that cycle of making sure that you're sticking into a process really kept the sanity throughout the whole thing. So I'll stop there.
Yeah, and so that's a great summary, and from both Tom and Chris, and I think that the next question, I'm going to talk a little bit about that nimbleness, that pivoting, Chris, that you referred to. I mean, it's really about, when you talk about a disaster and you talk about emergency operations, it's really about how you enable change, right? It's all about the fact that every day is different. Every hour within every day is different, because so much is changing so rapidly, and you're trying to assimilate situational awareness into your decision making so that you can pivot, to anticipate the impacts, right? And for us, for healthcare, I say it's a straightforward process. It's probably not straightforward to everyone, but once it's like anything else. Once you become, you develop that knowledge, then for healthcare, it's really it's clinical information, it's resources, it's staffing, it's space, staff, stuff, just like anything else. But you convene your stakeholder teams and you accelerate the process of decision making, right? You accelerate that op tempo. That's the planning P. That's emergency management, and you enable a nimbleness so the organization can it can change a hospital floor into a COVID ICU overnight, instead of over a period of weeks and months, which it would take in a normal, during normal blue sky, right? If it's going to change, what it does in a building, there's a lot of decisions that have to happen, a lot of money that gets spent, and a lot of resources. In the midst of a disaster, you do it in hours instead of weeks, right? So what did that look like? I'm gonna go to Tom first. What did that look like, Tom, in your organization I mean, when you talk about an association of railroads, right? I mean, that's that is the most, it's hard to imagine, I think that's where that term critical infrastructure originated, right? because there's so much infrastructure there that's so it's all encompassing. Was there a process that you did that in the job where you had a group that spanned the entirety of that sector that was coming together on a daily basis or even more often and making decisions in the moment?
So we had a structure in place through the committee approach that I referenced earlier. And I think the two that are most engaged in the COVID-19 response have been the Committee for the Chief Medical Officers. So those are the doctors at the major railroads, freight and passenger around the country who manage the worker health and safety programs. And then there is the group that I'm privileged to lead, the Rail Security Working Committee. And our approach expands beyond the term security to encompass a range of emergency preparedness functions. In this case, that included adapting our procedures for COVID-19 preparedness and response. So we didn't have a specific pandemic committee, but we took our security focus committee, as we've done for hurricane preparedness, as we've done for response to demonstration activity. We adapted the same coordination process, information sharing approaches that we maintain on a regular basis through that structure and through a group called the Railway Alert Network that supports our information sharing process. That sounds very grandiose, but it's 3 people managing an information sharing approach concept. But we took the communications and coordination process we already had in effect through the committee and just adapted it to the needs created by COVID-19. So we didn't have daily meetings of that group. We have a regularly scheduled monthly approach in terms of coordination teleconferences, but we're in daily contact as part of performing our functions in any event. And that pace of that communication, pace of those interactions picked up through the pandemic. And I get back to the point of defining the role that you can play in the position I hold and being the lead representative for a committee like this. The railroads, through their medical staffs, through their security and emergency preparedness leads, they're the ones who are actually putting into effect what needs to be done to create conditions to mitigate transmission of the virus. So they're doing the groundwork, they're working with employees, they're training people, they're ensuring masks are available, other PPE, they're looking at testing and contact tracing. They're doing all that work. At my level, we're freed of that. So we have an ability to look forward and try to anticipate what is it that we can do to make the job easier for those we support through our industry security committee as they manage the unprecedented effects of this pandemic. And in that respect, we were continually looking ahead, as I indicated earlier, looking ahead on restrictive orders and what we would do to get our workers exempted, looking ahead on access to facial coverings that would give us enough stock to get past that really tough period at the outset of the pandemic when supplies were short, and where FEMA, although acting with good intentions, was aggravating that problem by consuming so many with their massive procurements. And on testing and vaccines, we've taken the same approach. What can we do to get a level of prioritization for our workers when it comes time to testing? We're looking to get testing accomplished, and now with the vaccinations. We made our initial proposal on vaccinations and prioritization of the workforce back in July of 2020, in anticipation that some months down the road, a vaccine would be available. And at the outset, we got a lot of pushback from DHS saying, we don't know that there's going to be a prioritization for essential workers. We don't know if we can support that. We unified our efforts. We didn't act solely as a railroad industry. We worked with the transportation sector, coordinating council process to get a unified position among transportation modes. We carried that to the Critical Infrastructure Cross-Sector Council, which represents industries across the 17 sectors, as well as several subsectors. Got them on board with a unified position, so that in early September, when the National Academies of Sciences, Engineering, and Medicine, on a very short comment period, I think it was just 3 days, published their projected recommendations to the CDC on vaccine prioritization, we were ready to provide a position that said, we believe essential workers as identified by DHS in its guidance through the Cybersecurity Infrastructure Security Agency, CISA. We believe those essential workers merit consideration for prioritization for vaccinations for these reasons. They're working in close quarters areas where the interaction is high and maintaining social distancing may not be practical. They're traveling in crew vehicles to get to their work sites. They're interacting extensively with the public, with workers in other industries. They operate across multiple state borders. And so there's issues there of not just the interaction with people who might be exposed to the infection, but also some of the challenges that can emerge if you're in a state different from your home state and whether you can get medical care and prioritize for vaccinations. So by early September, we made that input through the Critical Infrastructure Cross-Sector Council, and to its credit, they adopted as what they considered a phase 2 prioritization, essential critical infrastructure workers. We then continue to work through the Critical Infrastructure Cross-Sector Council with CDC, and that eventually led to the CDC guidance that has essential workers in phase 1. So I think the role, the pivot point for us is we have the ability, we're free to actually put into effect the plans that we support. And therefore we focus on what can we do to make sure we're anticipating the problems on the horizon, try to create conditions where we can turn those problems into opportunities so that when we get to the point where it matters to be prioritized for vaccines, we've done the necessary foundational work to make that happen.
So Tom, just a quick one. So you all convene the railroad corporations. You are essentially the emergency managers. You guys convene the meetings. You guys put the situational awareness into the conversation. Is that a fair statement?
Yes.
Or,
So yeah,
okay.
we are coordinating the security and emergency preparedness program for the industry, and we're informing those programs through an awful lot of information sharing. And Tom Moran can attest to the materials we provide. We feel we have a very important role to play in trying to cull through what I think the concern we have now is not a failure of information sharing. It's sometimes the volume is so much you can't actually manage the information well.
Yes.
The role we play is let's look through these reams of sources of information and cull out what matters and explain to our railroads why it matters and what they can do about it. And that's the role we play in trying to ensure they've got the awareness they need to address the various contingencies that we support, which include the pandemic.
That's emergency management, right? I mean, in the job, there's so much information, there's noise, there's signal, there's and then gleaning out that actionable information and providing in a digestible way to those stakeholders who in your case are the railroad corporations, right? That's classic emergency management. And then you went and you're operating at the security emergency management level and the chief medical officer. So that's and they're dealing with the tactical level, which is the personnel running the railroads essentially, right? And
working with them to create the conditions for limiting the ability of the virus to spread in our work environment.
Right. And then you went back and then now just briefly, the coordination, the connection to government. You talked about the cross-sector coordinating council.
Yes.
How did you talk to? Did you talk to FEMA? Who did you talk to?
Okay, so largely working through the Critical Infrastructure Cross-Sector Council, our principal point of contact is CISA.
CISA.
So okay. we would have throughout much of the pandemic. It's shifted to a monthly tempo now, but throughout much of the pandemic, we had weekly conference calls with Chris Krebs, who was then the director of CISA.
Right.
We bring these priorities to him.
Okay.
Here's our proposal on facial coverage. Here's our proposal on testing. Here's our proposal on vaccinations. Here's why it's important. I'll give you one practical example how this worked. Early on when CISA issued its guidance on essential critical infrastructure workers, at that point, all the states were issuing were stay-at-home orders. And so the guidance came out on March 18th. Well, that last week of March in 2020, states began to issue travel quarantines. And we found right away is while the states had exempted essential workers from the stay-at-home orders, they were enforcing the travel quarantines against them. So in transportation, within a couple of days of these orders taking place in several states, we were able to catalog a dozen instances in which railroad workers or truckers or pipeline workers were prevented from getting to their jobs because the state had put up a quarantine order. So we went to Chris Krebs very quickly. One of these calls happened to be on the docket for that Friday. And we said, Chris, we can't have this. And we've documented these instances. And what's happening is the states are reading the guidance very narrowly. And they're looking at it and they're saying, you issued it to deal with the stay-at-home orders. Therefore, we're applying it to the stay-at-home orders. And we said, Chris, you issued it to cover the range of activities that state and local authorities would put into effect, including travel quarantines, including curfews, including all the other sorts of restrictions we've seen had to endure over these many months. And Chris, to his credit, took that message. He had a teleconference the following Monday through the National Governors Association, talking directly to state governors, and he made the point. He said, look, we really encourage you to use this guidance with exempting workers from the range of restrictions that have been into effect. And we have not had a single instance of a challenge or a block to a transportation worker performing their duties since that success in the latter part of March.
Yeah, it's a great example, and then that's just showing how this system should work. And again, I mean, you didn't talk to Chris Krebs for the first time, in March of 2020. You had established that you had hardwired that communication link before and had worked issues before, and so there was a trust there. There was an understanding, and you just basically went back to that. So that was an ongoing process. You didn't have to build that aircraft carrier in the water like Chris talks about, right?
No, we had built up good trust. We had confidence that each side was interested in a positive outcome for the other.
Chris, let's go to you for a second. I want to just go. I'm interested in the in job number 3, which was when the mayor called you. What was that call like where you thought you were busy, and then the mayor called you and said, I want you to run my coronavirus program. Can you tell me about that call?
It wasn't very long of a call. She said, so like I said, we were getting into the process, and I was reminding our city administrator that we have a process. And so I was, sending him the documents and saying, here's your district response plan. And here's your, pandemic influenza plan. We shouldn't go too far off of these in the initial planning phases. And they hadn't even set up an EOC yet. This was just some initial planning on how do we get organized. And there were a little bit of fits and starts with that. And eventually I said to the city administrator, all right, we need to declare an emergency. And my advice to the mayor is, get her public health emergency and the state of emergency declared for the city. And he called me back about 10 minutes later, and he said, mayor wants you in the office, and let's get started. And at that time, I told my deputy in the agency, hey, you've got public works for the next couple of days while I help the organization get going. And it's been pretty much like that since February. So
that's classic, man. You open your mouth,
Yeah.
I mean, right?
Yeah.
I mean,
but in all honesty, I mean, and Kelly, you know this, and many people, and Tom knows this, and many people on the phone know this. It's, when there's a big job to do, everybody has to come in, and everybody has a role to do and a place to play in that.
Yeah.
Especially when you're in one like we are now. I mean, it's a year-long disaster that is continuing to be in response phase, right? There's not a whole lot of disasters that we've done in this country that's had a year-long response phase. So there, within that, there's a lot of fatigue, and this is a virus, so a lot of sickness and death for that matter. And so, throughout that, there's just continuing need to fill roles, give people a chance to come off of it for a bit and come back onto it and all of that. So it's been an interesting learning curve. And I think the nation has built a lot of good, strong emergency management credentials throughout this, which is heartening for those of us that work in this industry to see that, now you have a lot of people who had to do this, and some of them learned, like myself, learned a lot of lessons going through this, of things that I thought were going to work great, that we had to reel that back and say, okay, let's retool that and do that again. And, so I think it's been a boost for the profession, the nation. And I think it's been a wake-up call across as well for many different aspects, especially public health. And the role of public health when things like this happen. So I think that's been a very interesting experience in that.
So I'm gonna throw an unfair question at you, Chris, because I know you well enough to know that I can do this. But so and it just has to do with, you've been in this business, long enough. I mean, and know enough and have done enough. So if you had to do it over again, and you were at say at FEMA or at CISA or somewhere, even in the White House, and you had to, and it was January 2020, what are we going to do differently next time? What would you do differently if you were there, knowing what you know now?
Okay. Just to be honest of the situation that happened, not to be political in any way, shape, or form, just looking at truly how response happened at a national level for this disaster. Number one, we never really engaged our national response infrastructure in the response. A lot of this was, hey, the vice president has a task force and they're running the response, and that's not the response. There was a lot of efforts within the Federal Emergency Management Agency, within HHS and ASPR, of folks that have been around doing jobs for a while, that are in senior to mid to senior level positions, and trying to position those agencies in their capacities in the right way. But I think that there was generally a lack of, as I said earlier, follow the plan. We have roles and responsibilities for different agencies at different levels, and they're very important to do. And when you don't have, for example, the regional administrators of FEMA, I think, really leaned forward and got out in front pretty far, where some of them, I think, scraped their nose on the ground for leaning so far forward, and unfortunately reaped a little bit of an unfair play on them. But I think at that level they were trying. It was very difficult for that to go all the way up through the chain to get the appropriate response that we should have had as a nation going through this. My hope now is that those things will engage, and it won't be resting at a policy level, but actually resting at some of the operational levels that are there at the federal government, because they have a huge role. We're starting to see that now. FEMA's sending incident management teams out to all the states to work on vaccine, and they're doing it in the right way, where they're doing it in the right way, where they're asking, how can we help, and how can we come in and assist in this major lift that you all have to do, which is a good thing. They haven't been here for the rest of it though. So now bringing them into that level with that kind of connectivity is a little bit difficult, but we're working it. So to answer your question directly, Kelly, we should have had FEMA running the response with HHS as the lead agency, and the CDC right there with them, and that apparatus working across the nation to do things like, we have a national ambulance contract that's in place whenever we have a huge mass casualty that can be used. We should have been doing the same thing with our medical professionals, so that we can move them throughout the nation where they were needed, in things like that. So, there were a lot of things that was not done for response, and it was really just kind of left out there for folks to do their own thing. And you can see across the nation how doing their own thing resulted in not such great outcomes in some places, because the support just really wasn't there. So
that's extraordinarily well put, Chris, and I think a lot of people agree with that. And I think, like you said, work the plan, establish those connections, right? I mean, connect it all together. It's a big, it's a big, it's a big, like an integrated circuit that has to be hardwired. So hardwire those connections together and connect people together in communications, and then provide that shared situational awareness. And the argument is, well, you can't order those people around. I think when you talk to Tom, you talk to the Sherry Stone and Doug Baker and Robert Crow, they know, and the All Hazards Consortium is a great example. Putting people together in the same conversation with a use case or a problem doesn't mean that it's not a command and control issue. You're not taking charge. You're creating an environment for a shared understanding of the problem and a coordinated response. So everybody doesn't have to do the same thing, but at least they know what everybody else is doing and they can talk about it. They can talk about, well, we're doing this and here's why, right? But it's about that connecting together piece, right? And like you said, Chris, you said, we don't do it at a policy level. That's the point, right? You bring it from policy through operations and even into tactics, but it's the heavy lifting, and you bring those teams back together again, right? Tom, same unfair question to you. What do you do differently if you're running the show in January, February 2020?
I think it's not an unfair question, because I think it's precisely the area where I'd be paying a lot of attention to what might have been done differently. We actually had there's a group called the Surface Transportation Security Advisory Committee, established by the TSA administrator. And I've been a part of that and privileged to chair it here for the first couple of years of its existence. But one of the focus groups we created, and it was before the pandemic, was on emergency management and resiliency. And that group then devoted a lot of attention to how did surface transportation organizations manage this pandemic, this health emergency, and focused in a very concise and effective way on what worked well, what didn't, and how can we improve looking forward. I think if I were in a position looking ahead in terms of what would have been done differently, there's three areas that come to mind. One, what is the right role of the federal government to play in supporting response? I think in many cases, there's an impetus to be seen to be doing something, and often that doing something translates into decisions that may not be best for how the incident gets managed effectively across all industries. And the one that comes to mind for us is the mass procurements of facial coverings that FEMA undertook. And so the market was suddenly warped by a government agency buying hundreds of millions of these, again, at prices higher than would normally be paid in the market. And so traditional suppliers now were lost to industries that had relied on them for years. And the suppliers, I think, felt like any supplier would. If I can get more money for the same product from a different purchaser, I'm going to do that. And these kind of creative excuses came up about FEMA seizing facial coverings. Well, again, that wasn't going on, but FEMA was seizing the market essentially through the procurements. So to me, that's a classic example of what's the right role of the federal government. Is it to go out and buy facial coverings and distribute them to industries?
Right.
Or is it to facilitate the production of facial coverings so industry needs are met? The Defense Production Act could have facilitated the procurement and distribution of facial coverings and aided meeting industry needs, as opposed to the government actually going out and buying them. So that's one area. A second is, I think we have a real opportunity now to look at where critical supplies come from. I think we've done a very good job looking across sectors at interdependencies and organizations identifying, what do I rely upon the electricity sector for? What do I rely upon the water sector for? Where I think we have come up short is looking more closely at, well, what is the glue that binds all this together? And we've learned some lessons in the pandemic. That glue is things like facial coverings that are only made in China, medical supplies that are only provided in China. I think we have an opportunity to look back now and say, how can we incentivize production of these essential materials? So if we find ourselves in this situation again, we're not relying on importing them. We've got a sound market structure in the US to provide them. And that means in some sense, you got to incentivize the market. And as we've spent trillions upon trillions of dollars in stimulus, I don't know that we're stimulating anything. What we ought to be stimulating is a sustainable impact on our economy going forward, and ideally on our preparedness. If we're spending that much money, we ought to be able to invest some of it in incentivizing markets in the US, manufacturing in the US to produce these items and ensure that we have necessary stocks going forward. And then lastly, and I think this gets into, again, this, what are the investment opportunities that exist? If large appropriations are being undertaken for the purpose of an economic stimulus. And what are you aiming for with economic stimulus? Is it to give people money to go out and spend it? Or is it to invest in ways that going forward will produce more jobs, will make your economy more efficient because you've produced the right infrastructure and the right commodities to have an ability to be in a much better position afterward than you were before? So the example I use very quickly is the decisions that ultimately resulted in the internet were made in investments in science and technology development that began in the 1950s. And a sustained commitment over an extended period of time produced these great technological breakthroughs that have given us a lot of what we enjoy now. But you've got to have that foresight and say, look, if I've got trillions of dollars that I'm considering spending, what are the best places to put it that will make our economy more efficient, that will help address some of those interdependencies and give us a sort of structure that can be responsive to emergency situations in the future?
Yeah, and I just, we got a couple minutes left, and and just to get on my soapbox, right? I mean, every problem in a disaster is a coordination problem, every single one. And even those three examples, Tom, you gave, I mean, had there been a coordinating structure, had there been a group of people together that were sharing information before the job and then during the job. So FEMA going out and taking over and buying all of the N95s, had they been working through the regional administrators and the cross-sector coordinating councils and talking to healthcare sectors and talking to executives about what was going on, they likely would not have just at a stroke went and done that, but they would have talked about, well, where can we solve these individual anomalies,
Right.
and not buy up all of the product. Well, where can we solve problems here or there, or we can, just like you were doing, Tom, in the beginning of the job, where you were making sure that people could cross borders, solve the problems that are arising out of the incident. Don't create a problem by imposing a solution just without, in the absence of a plan and the absence of discussion. These are coordination issues, right? And I think Chris talked about that. What would you do if you were in January and you were the boss? I'd coordinate the job. I would get the right people in the right place at the right time and manage the information and the resources and solve the problems. And that's what they pay us for, right? And but it's not a political issue. And Chris said that we're not going to talk politics here. It's not a political issue. It's just that I guess my point is that the All Hazards Consortium shows the way, right? The way that they bring these cross-sector groups together around use cases, around the problems, and that I think is the mechanism that allows for those improved outcomes in the job. So with that, I'm going to call an end to our session. I'm going to thank you, Tom Farmer, very much. Great input. As always, Mr. Geldart, thank you for your input. And we didn't have a lot of questions in the chat, Laura, but I think we covered a lot of ground. So back to you.
All right, Kelly. Kelly,
Thank you,
so
Kelly.
much. Thank you, Chris. And Tom, thank you so much for being here. That was
You're
great. I
welcome.
really appreciate your time.